exposures, that I think it would not be a difficult recommendation to accommodate.
Good, and if there are no other further clarification questions specific to Joanne, I'd like to move into the panel discussion and open this up now again to the committee members and consultant and the panelist for further discussion and consideration of either issues raised by each of the panelists or cross-cutting issues generated by the four presentations. And there are 2 microphones in the front for panel members. Committee members. Please, Suzanne.
Thank you. Let's see, can you hear me? The mics aren't working.
If we have AV in the back, could you turn on the front mics, please?
I saw him turn them on.
It is, it's working.
They are working now?
Yes, they are.
Yay. Thank you. Suzanne Murphy, I'm a consultant to the committee. Thank you all for wonderful presentations. I have a couple of questions, but first of all, I'd like to perhaps ask Alice and maybe Trish to comment on cholesterol, because you surely knew we were going to ask about that. So I've read the wording fairly carefully, and you say you're not bringing forward the 300 milligram ceiling. Does that mean someone putting together WIC recommendations doesn't need to think at all about cholesterol?
Okay, I will start. The committee was asked to evaluate the current dietary patterns in the United States with on the basis, and I'll, give all the blame to Trish, and her staff did it very well. And current intakes of cholesterol in the United States are, the mean intake is about 250 milligrams for women and about 350 milligrams for men. We were asked specifically to identify nutrients of overconsumption and underconsumption. On the basis of those data, we did not identify cholesterol to be a nutrient of overconsumption currently in the United States. So that's why we conclude, well, that's number one. And then number two, the data on the impact of dietary cholesterol on plasma lipoprotein profiles is not as strong as it had initially been assumed. And part of that is because when the initial work was done and the meta-analysis were generated, the range was quite broad, from about 200 to about 800 or 900. And if you look at the response of dietary cholesterol and lipoprotein profiles in the area of 200 to 400 or 500, it's actually not particularly linear. We know that there's a certain subgroup of individuals with certain genotypes. The one we know most about is ApoE4 that are particularly sensitive, but the majority of the population doesn't appear to be particularly sensitive to dietary cholesterol. So that, for those two reasons, we felt that we couldn't just automatically carry forward the recommendation from the prior committee, which carry forward the recommendation from the prior committee and all the way back. And that we also took into consideration the American College of Cardiology, American Heart Association lifestyle report that came out at the end of 2013. And they actually came to the same conclusion, that the evidence for dietary cholesterol and plasma lipoprotein profiles was not as strong as had previously been considered. And one of the other things is it does take the emphasis off of what's felt to be the major dietary factor, which is saturated fat and then total calories. And I'd like to also point out that the conclusion of this committee is actually consistent with that of all other guidelines that we could identify worldwide. So it's not something that's particularly aberrant. It just is different than the way we have thought about it. Now, does that mean that we can recommend that the American public consume as much cholesterol as they like? No, we certainly didn't say that either. I mean, this was all within the context of current consumption patterns. And I think it is important to note that in the U.S., eggs do tend to be consumed with bacon or sausage, and sometimes with cheese. But there is clear guidance on restricting saturated fat intake, and those are the major sources of saturated fat. So that also needs to be factored in. Now, what the decision is going to be on whether there be any specific guidance on dietary cholesterol, we'll just have to all wait until the end of this year and find out.
You did great.
Suzanne, you had a second question?
Yes, for Joanne. The reviews you described would clearly be very helpful to the WIC committee, but I'm wondering about the timeline. So the committee's on a fairly tight schedule. Do you anticipate any of the reviews you mentioned being finished, let's say, within the next year?
The timeline for the reviews is 2015 to 2017, so the timeline is completely concurrent. There'll be an order of activities, so there may be some that are complete but probably not available until 2017.
This is Patsy. I'd like to follow up on that. Do you have a sense of which are the reviews that might be conducted earlier and might be available in 2016?
We are just at completion of recruiting our technical expert collaboratives. And so one of the first activities that we do with those expert panels would be to refine the systematic review questions, and working with that federal expert group, looking at, what's the final list of questions, and then I think we would have to really work with our expert panels to determine what is the appropriate order of execution. I would say that the 3 technical expert collaboratives will be working concurrently, and so that the work will be done. I can think that there's a certain order that makes the most sense, but I wouldn't know that for a few more months at this point.
Other questions, comments from the committee members? Rachel.
Hi, it's Rachel Johnson, primarily for Alice. So in spite of what we see constantly in the popular press with the headlines to eat more butter and eat more bacon, and the fact that, nutrition scientists just, that we don't know what we're doing, I detect absolutely no backing off whatsoever in the recommendations to limit saturated fat in the diet. And I wonder if you could sort of just comment on the committee's, how you came to that, because I think a lot of us feel like we really need to hear the rationale, because there's just so much noise out there now around saturated fat.
Sure, and in order to do that, I'll have to talk a little bit about the history of some of the more recent systematic reviews and meta-analyses. The systematic reviews that looked at the impact of saturated fat on primarily cardiovascular disease risk or lipoprotein profiles, some of them separated out the studies that substituted polyunsaturated fat for saturated fat and carbohydrate, particularly refined carbohydrate, which is the majority of the carbohydrate we consume, for saturated fat. So reviews like the Jacobson one, that was a pooled meta-analysis where she was able to get individual data from, I think it was 11 prospective cohort studies, separated the substitution of the polys for SATs or the carbs for SATs, and clearly there she showed that the risk for cardiovascular disease was lower when you take out saturated fat and put in polyunsaturated fat than with carbohydrate and sugar, carbohydrate versus saturated fat. Some of the other ones, the Torino and then the more recent Chowdhury one that got a tremendous amount of attention, did not segment out what the substitution macronutrient was, and they reported null effects. If you look at it from what we know about biological plausibility, you also, the evidence suggests that saturated fat being displaced with unsaturated fat has a positive effect, whereas replacing saturated fat with carbohydrate results in dyslipidemia because you have this huge flood of glucose that's coming into the liver. Peripheral tissue can't handle it all. What the liver does to avoid becoming really fatty is it synthesizes fatty acids. It can't retain those fatty acids. They're packaged into triglyceride, sent out as VLDL, and then what you end up measuring is elevated triglyceride levels. And non-HDL cholesterol is also a risk factor for cardiovascular disease. So although it makes for popular press, because great, everybody wants to know what people do wrong, and certainly the nutrition community, from a scientific perspective, there doesn't seem to be evidence to back off at all from saturated fat.
Thank you.
And so I want to take the moderator's prerogative to ask primarily Trish, but I'm interested in the other panelists' point of view, whether you think there is any potential impact of the information that Nancy provided, that for 3 to 5-year-olds, the energy needs might be overestimated, and would that impact food pattern analysis at the 1,000 kcal or 1,200 kcal patterns, in particular relative to total nutrient needs of 3 to 5-year-olds?
Very good question, and when I first heard her topic for today, that was my panic. But then I heard, and I heard again today, that the estimates at the sedentary activity level were very close. And for all of our analysis of nutrient adequacy of the patterns, we set ourselves the hardest standard, is what I say, is that we aim to be nutritionally adequate, assuming a sedentary activity level. And so those patterns that I showed you and the ages that they were assigned to are all assuming sedentary activity. That doesn't mean we recommend it. It means that if a person is active and requires more calories, they will, as you saw, the amounts and the patterns of the foods go up. So they will get more nutrients. But we aim to be adequate at the lowest possible calorie level. So as long as those are close, it would not affect our work. It would affect perhaps when we list the range of patterns for various levels of activity, it would definitely affect those, but that would be it.
Patsy, could I say something? Oh.
Yes.
And I think that circles back to one of the findings from the GGAC about nutrient-dense food choices, that it's really something that we should always keep in mind.
Great, thank you. Suzanne, I think in light of time, you may get the last question.
So I'll be real quick. What concerns me about Nancy's good information is that we're putting the children in the wrong food pattern. Because if I do my calculations right, you're saying we may be overestimating by 200, 250 calories. And if we have them at 1,400, maybe they should be at 1,200. So there's some real implications. So I appreciate your presentation.
Any additional comments? Okay, please, Angela. You didn't quite get the last word, Suzanne.
My question is also for Nancy about the makeup of the sample as far as race and ethnicity and what implications you think that that might have for the findings.
Actually, in Houston, Texas, we have a very diverse population, and so it was pretty representative of Black, Hispanic, and white kids. But it's a convenient sample, I'd be the first to admit, and it's rather small. I mean, it's only about 100 kids. But again, if you look what the DRIs are based on, they're not huge numbers, as you saw. I think the important thing is that you have to know your population, and I showed you the distribution of our children. The highest percentage was actually in that light activity, but I think most kids would fall in the light or the active category. When you think of the children's sort of physical ability, they just have a much more limited range. So I think it's widely applicable to all groups. Could I bring up just one issue, which I wanted to comment both for Trish and for Alice? You talked about, evaluating food patterns if they're adequate either for consumption of nutrients or overconsumption. And I had the privilege to help analyze the FITS data, which is a very large sample of preschoolers. And there's strong evidence, and I'm pretty sure it's been documented by other national surveys, that there's actually risk of overconsumption of very specific nutrients, retinol probably being the most potentially harmful. But there's others like zinc, which was quite high. So Trish or Alice, could you comment on the overconsumption of nutrients in this age group in your current patterns?
Well, in the patterns, we do check against ULs as well, and from foods alone, foods and beverages alone, there was no evidence of overconsumption. But again, some of those foods that might be in certain children's diets overconsumed. That's what I was talking about with the fruits and the dairy, that some children are consuming substantially, especially young children, substantially more than we recommend. So the patterns themselves, I feel very confident about. But it's true that, when you look at the total dietary pattern, that in order to make room for all the different food groups and the range of nutrients, that even, people say, oh, there's no such thing as eating too many vegetables, but there could be, because they need the range of.
I think our children are eating highly processed foods, and they're highly supplemented and fortified. And so we had some very high levels of retinol, for instance. So if you took the raw ingredient, sure, you're going to be nice and safe, but that's not what kids are eating.
And I think that's just a general issue that the databases will probably have to catch up with, because it does seem there's been this extraordinary proliferation of fortified foods and beverages, some of these vitamin waters, these kinds of things, and we don't know what age groups are actually consuming them. But at this point, it's probably very difficult from the data that's available to get a good handle on it. And we just... Oh, okay, Nancy says there are good data, so hopefully that'll be taken into consideration.
No, the FITS data is a very large data set, and there's been others subsequent publications that have also confirmed that in this age group.
And have actually, you think, accurately been able to capture that huge range of fortified foods? Because with something even like for orange juice, do all people that are buying orange juice keep track of whether it has calcium, whether it doesn't have extra calcium, if it has vitamin D, and is it consistent?
Well, I think it's an ever-moving target, as you know.
Okay, that's what I meant.
But at the time the survey was done, I think it was accurate.
Can I ask another one?
Yes, please.
Sorry.
Hi, I'm Shannon Whaley. Thank you for your presentations. I have a question about fruits and vegetables. I think probably everyone in the room is familiar with our recent fruit and vegetable, particularly vegetable challenges that emerged. We all looked at the recommendations from the DGAC for 2015, and it looks like the fruit and vegetable recommendations do not seem to be changing from what they were in 2010. So I wanted to know if there was discussion of that would be relevant. And also, because vitamin C is a nutrient of concern that you discussed, Alice, if there was any discussion made of the amount of vitamin C consumed through juice versus through fruits and vegetables, and what the committee might have talked about in that respect, or what research might be available to us. Whoever can answer.
In terms of the vitamin C, It was not considered a nutrient of public health concern. It was an underconsumed nutrient, but they did not identify any specific health outcomes dependent on it. But we do have the ability in the food patterns to look at sources, and we did look at food group sources of a number of nutrients. It's a little more difficult, it can be done, to look at actual intakes, and we did an estimate of actual intakes of some of the nutrients of concern. The same thing could be done for vitamin C. We haven't done it yet, but we do know obviously what proportion of the recommended intakes come from the various constituents. Yeah, and what was the other? I'm forgetting the first one.
Just about the stability of the recommendation for fruits and vegetables from 2010.
Oh, yeah. After all the analysis was done, the committee did not recommend any, and they looked at a number of options and did not recommend any changes. So in the DGAC report, the patterns are identical, although Suzanne points out that there's a little titch here and there. Sometimes they're rounding numbers that have been rounded differently, and sometimes it's a different word that's used, but essentially you can consider them the same.
In addition, it brings up another point, and that is that there is a discordance between the nutrients that were identified that were underconsumed relative to the EAR or AI and those that are thought to be a public health concern, and that really does raise the issue of whether it's time to reevaluate the EARs and RDAs, because they may be off relative to where they should be.
And on that note, we have reached the end of our time for this session, and I ask you to join me in thanking our presenters for a highly informative session. And I would like to ask Kathy, would you like to shorten the break a bit because we're just a little bit behind? Well, in that case, your program says to be back at 10:45, but you actually please be back and in your seats and ready to go at 10:50.